All right. Hello, I am Justin Murillo, and this is a presentation on the mental disorder PTSD. And so, what is PTSD? Well, I have 3 videos here to, to inform you, or at least give you a brief information on it. The first one is George Carlin. It's a bit from an old show of his, and I thought it was really funny because it talks about PTSD and it's basically about euphemisms and how over time the name of PTSD used to be originally called shell shock. So, there's a lot of interesting stuff. And the next one is from a movie. You probably know it. It's a Marvel movie. It's Iron Man 3, I think. And it's basically Tony Stark experiencing, the symptoms of PTSD because of a traumatic experience he has experienced. It's pretty cool that they included that in a mainstream movie. The next one is a really cool, informative video on PTSD. No jokes or no movies. It was actually a really informative video. Okay, what is PTSD? It is a disorder in which, you go through a traumatic event, and it was so traumatic that it's just a reoccurring thing. It just throughout your life. And it's after, like it says, after witnessing a terrifying event. And the most common one is military veterans, and I guess second would be sexual assault victims. Because just the the things that they had to go through were pretty intense, and it just flight or flight. It's just that the thing in your brain that activates it. It just snaps, and you have to live with it. But unless you get treatment and stuff. But we'll talk about that. And there are many symptoms, and here are the symptoms. The symptoms include nightmares, which are very vivid and usually keep the person with PTSD from sleeping. And so it just gives them a hard time, dealing with it. It usually happens night after night, or it can happen like one night, and then you'll be fine the next 3 nights. And it's pretty crazy. And next one is unwanted memories or flashbacks, and you could just be hanging out with your friends, coworkers, and someone drops a fork, and you go into combat mode. It's just not fun, because you're not supposed to be, and it's just stressful. And another symptom is avoidance of situations and settings, and that has to do with maybe you don't even want to go in your kitchen because something in your kitchen looks like something that was on the battlefield. I'm going to keep using the veteran reference, but it's something in your kitchen and could resemble something that you saw during combat, and you just won't even go in there to get food. You'll have to ask someone. And the next one is heightened reactions. And so usually, like I said before, you drop a fork, you just go into combat mode because it reminds you of a gunshot or something. And it's not appropriate for the setting, because you could be at work, a party, anywhere. The next one is anxiety. Anxiety is a common symptom of PTSD. Anxiety and depressed moods, they're pretty intense with PTSD patients, and it's very hard to cope with and deal with. So treatments, therapy, for most people, therapy helps a lot. And CBT, or cognitive behavioral therapy, it improves your symptoms. It suppresses them. It teaches you skills on how to, you learn different ways to cope with the stress that comes with those flashbacks of the nightmares or any of it. You can learn a bunch of different ways. And basically the goal of the therapy is to change the thought process of that leads you down a rabbit hole of bad thoughts, and eventually just, you know, it blows, it bursts. And another option could be family therapy if the patient is up for it and the doctor recommends it. Another form of treatment is cognitive processing therapy, and it's way more extensive than therapy or just, you know, just regular therapy, because usually these patients are you know, they're in these sessions for an hour and a half, maybe even 2 hours, and they go in great detail. They talk about it in great detail. That sometimes they even write it down about the event that was the traumatic event, and they discuss why the event triggers these great emotions and everything, and it is very effective. The next one is prolonged exposure therapy. It's for those with extreme avoidance issues, and mainly because if you keep on avoiding, you know, these situations, and you just neglect how to deal with it, it gets worse and worse. And exposure therapy helps with that. It you it teaches you ways on how to slow down your anxiety, you know, breathing techniques. I read online that people use breathing techniques to calm yourself down, and you know, it's in the name, it's in the title. This form of therapy exposes you to similar situations or recreations of that traumatic experience. So, eye movement desensitization and reprocessing. It is fairly new, fairly new. I think it was the 1980s where it became a normal form of therapy and recognized. It's non-traditional. It doesn't rely on talk, medication, or therapy. It uses, you know, hand movements or like finger movements or even a flashing light to 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 change the way, like before, like in regular therapy, it changes the way you think about a certain situation. And it's just, you know, it is somewhat effective. It mainly for people who haven't who've been through all the other therapies and it hasn't worked, or medication, obviously. The next one is stress inoculation training. This could be done by yourself or with a group, and it obviously changes the way you deal with stress. Because if stress is the main factor, then that's what you gotta fix that. So it, you know, breathing, massaging techniques might be utilized, and like it's just the you deal with stress and you learn different ways to deal with the stress that comes along with PTSD, and it's very effective. Uh, Lastly, or one of the last ones, is medications. This is especially useful for PTSD patients because basically what that traumatic event does is that it creates an imbalance in your brain of the chemical compounds, and you know, medicines such as SSRIs are good with people for PTSD because it opens up the receptors, and like Prozac, Zoloft, antidepressants, you know, beta blockers, like these all are common with PTSD patients. And there could be a downside to medication because it could negatively affect the patient, and basically like what happens is that they become dependent on it, and it's just not a good time because the patient, you know, now they're dealing with a drug problem, and it's a whole nother world compared to PTSD. And so, like it says right there, it says medication will either eradicate all of it or just merely suppress it, which is what most people hope for. So, and suicide, which is a big factor with PTSD, especially with military veterans. Like I said before, mentioning them a lot because it's mostly common with them, but suicide, you know, mostly comes when these veterans, they just don't have a way out. You know, they tried everything or they haven't tried anything, and they just think that nothing's going to help them. And so these traumatic experiences just haunt them, and it's pretty bad. So here are some celebrities who have had PTSD. You know, Ariana Grande, Whoopi Goldberg, Shia LaBeouf, Lady Gaga. You know, anyone can get it. It doesn't have to be a military combatant. It could be anyone, you know, Ariana Grande with the Boston bombings, or just sexual assault, or, you know, you were in a school shooting. All these could trigger or could lead to PTSD. And here, conclusion, PTSD has been a serious mental illness, and it was recognized by the APA, the American Psychological Association, in 1980. It could get really bad, very serious if it goes unnoticed or untreated. And therapy and medication are great ways to treat it. So, yeah, um, that's it. Thank you for watching.